Okay, so James has talked you through the main principles and concepts underlying thematic synthesis. I'm going to illustrate some of the main stages in thematic synthesis with some worked examples. Next slide, please. So I've chosen 3 different reviews that have all used thematic synthesis, all fairly recent. And these 3 reviews speak to different categories of how thematic synthesis is being used that James talked about at the very beginning. So I'm going to talk about one review which just focuses on perspectives and experiences of a particular phenomena. And in this case, it's older people's experiences of everyday travel. And then I'm going to talk about 2 reviews which focus in specifically on intervention perspectives and experiences. So how do people experience a particular intervention? And you'll see here we've got one on women's views of screening for type 2 diabetes after they've been diagnosed with gestational diabetes during pregnancy, and then one on parents' experiences of welfare to work systems. So I've chosen these reviews also to reflect the breadth of topic areas within Cochrane, and also within the Campbell collaboration. So these reviews are specifically around health, but also wider determinants of health, so employment and travel. Next slide, please. So looking at review questions and objectives, because these are so important anchor points in the review and to any thematic synthesis, you can see there the different review objectives across those reviews. So as I said, the first review is just focusing on people's experiences of travel, particularly in the urban environment. The second review, Dennison et al., is looking specifically at the views and experiences of women on a postpartum glucose testing. So their experience of a particular test within pregnancy, and they're specifically wanting to look at barriers and facilitators to attending for that routine test. And then the final review, Campbell were looking at welfare to work programs on health and well-being of lone parents, but particularly coming from the point of view to identify explanations and possible mechanisms for the way these programs work or don't work. And very interestingly, they noted evidence that these kinds of programs weren't producing the intended effects. So they wanted to know why was that. So classic use of qualitative research there to find out why a program works or doesn't work. Next slide, please. So this slide is just highlighting the review methods used in each of the reviews prior to synthesis. As James highlighted, thematic synthesis, generally the stages before synthesis follow stages for any standard systematic review. So you'll see there all of the reviews, for example, had explicit inclusion and exclusion criteria, all took a systematic approach to searching and screening. Interestingly, these reviews didn't sample their studies. They used all of the studies that they found. You'll see there they're quite low in number, from 12 to 16. And all of them used a quality assessment tool. Interestingly, only one of the reviews had stakeholder involvement during any of the conduct of the review. Next slide, please. So again, looking at the kinds of methods they use for data extraction and software, all of the reviews prepared evidence tables highlighting particular study characteristics. Some of them also highlighted some of the main findings alongside those characteristics. Some of them also include notes on the quality of each of the studies. In terms of study findings, these are the different ways that the the authors approach that. So you'll see that generally they were looking for, they considered to be findings, anything that was labeled as results. For example, in Dennison et al., Campbell et al. Also considered findings, any findings presented in the discussion sections, and Graham et al. Highlighted that they were using both the participants' accounts together with the author interpretations. All of those were considered as study findings. Next slide, please. So stage one, so across those 3 reviews, all of them carried out open line-by-line coding. And generally, it was done by 2 or more reviewers first, and then the whole review team or other members of the team came together to discuss those codes and agree on a coding frame. And then the coding frame was subsequently applied to the findings of all the included studies. So you'll see here how Graham expressed that. So they talk about giving 1 code to each statement relating to travel or the local environment, which was the topic of their review. And they highlight that each statement often had multiple codes. They highlight who was involved in developing those preliminary codes, and they tell us that the final set comprised of 151 codes. For example, bus travel gives a sense of belonging to society, and that older people were unwilling to rely on their social networks for help. So if you go to the next slide, please. So again, in the second example, broadly similar approach. This time, the reviewers looked at a couple of included papers first and discussed their initial thoughts. And then once they'd agreed on approach, the line-by-line coding was undertaken by 1 reviewer. This team tell us that they had identified 30 codes, which were then applied to the remaining included papers. Next slide, please. So this slide is just showing you an example of use of software for line-by-line coding. So this is from EpiReviewer. It's from a very, very old review, but because most papers don't include this level of detail in terms of showing you how codes are applied. So this is in EpiReviewer, but very similar systems in, for example, NVivo. So you can see here in the inset box, there's all the codes that are being used in the review. So you can see they're highlighted. Something about bad food equals nice, good food equals awful. And you can see there all of the text that is highlighted by that code. Next slide, please. So stage 2 for the descriptive themes, the general approach across reviews is that those related codes are initial codes are grouped together. They can be mapped, linked, and then labeled to form descriptive themes. And generally summaries of each theme are written and then discussed with the whole review team and refined. So if, for example, in the older people and transport review, they tell us that groups of related codes were combined into broader descriptive themes. And they tell us that this wasn't necessarily a linear process. They went back to the papers to ensure that the themes that they were forming were coherent and grounded in the views of and experiences of the study participants. And then they tell us that the descriptive themes related to, for example, older people's experience of different travel modes, their local environment, as well as individual level factors. Next slide, please. So in the review that was looking at screening for type 2 diabetes, you can see there on the left-hand side of this slide the examples of the primary codes developed from that line-by-line coding stage. And then this diagram also shows you the range of descriptive themes that the review generated. And it shows you that those primary codes leading to one of those descriptive themes. So the codes were or about, for example, invitations and reminders for testing, patient's responsibility, clinicians' behaviours and views, all go into this descriptive theme labelled arrangement of follow-up tests. I'll talk a bit more shortly about then its relationship to the analytical themes. Next slide, please. So the third stage, generation of the analytical themes, is really where, as a review teams will be going back to their review question. Those descriptive themes stick fairly close to the findings of the original studies. So across the studies, reviewers have looked to see the extent to which themes arising in one paper are arising in other papers too. So there's been a bit of translation going on across the studies. This third stage is looking at how to interpret those descriptive themes in light of your review question and objectives. So it's very much a process of interpretation and should be undertaken by the review team. So in our Graham et al. Review example on older people and transport, they tell us that the third stage of the synthesis involved identifying and mapping links between the descriptive themes to generate analytical themes that together made sense of older people's experiences of everyday travel. And the themes were discussed and refined with the project's policy advisors. Next slide, please. So the analytical themes were presented in different ways across the reviews, and this one's showing here the Dennison et al. Review focused on screening for type 2 diabetes after gestational diabetes. And you can see that they've organised their themes into a model which is really highlighting the influences on whether or not women will attend for their screening for type 2 diabetes. So in the middle there are the what this review team identified as their analytical themes. So the relationship with healthcare, concern about diabetes, the appointment and test, and family related practicalities. Each of those analytical themes has got relevant codes and descriptive themes feeding into them, and then they're organised according to whether what kind of factors will support women to go for screening after gestational diabetes, and the ones that work against that happening. And the model also distinguishes between what factors are at the healthcare system level and which are personal factors. So that's essentially the product from Dennison et al.'s thematic synthesis. Next slide, please. The other two reviews gave a much more narrative description, so they didn't attempt to summarise their findings within a figure or a diagram, but they took us through them narratively. So here, from Graham et al. On the left-hand side, they identified 4 analytical themes. So the importance of getting out and about for the older people, being an independent traveller, and then the local environment and local transport systems, how they could could impact on importance of getting out and about and being an independent traveller. What Graham et al. Highlighted, and this particularly came out of their interpretive work involving policymakers, was across these themes, was the idea of this intrinsic value of transport. And what really became apparent in their synthesis by listening to older people and their experiences was that they valued transport for its or their journeys for their own sake, whereas policymakers were coming very much focused on transport as getting from A to V. The older people's experience really spoke to the fact that the journey itself is just as important as the destination, and that really could impact on their health and well-being, their sense of feeling connected with their communities, and also really highlighted the importance of the local environment and those local transport systems. In the Campbell et al. Review, The Welfare to Work, they had overarching analytical themes of conflict and control, and they talked us through how each of those played out within their descriptive themes. So, for example, with the domestic role was very much in conflict with welfare to work, with their experiences of welfare to work policies. The welfare to work dictated that they needed to have childcare in place, which essentially took away their control. In terms of the welfare to work system itself, often they would have very restricted choices of training, which might conflict with their own priorities and preferences. So Campbell et al. Again provided a narrative synthesis of which is essentially summarised parents' experiences of welfare to work programs in terms of this sense of conflict and control, and going back to their original aims of their review, where they were wanting to shed light on why these programs weren't necessarily producing the intended effects. These themes of conflict and control give insight into why that was the case. Next slide, please. So I'm going to talk a little bit about how to assess the robustness of a thematic synthesis. And if I can have the next slide, please. Many of the issues relating to robustness are very similar to questions you might ask of any synthesis. So you might want to specifically look at the way reviewers have treated each study and how they've looked at differences between the studies, how they've translated the findings of one study into another. Has that been done consistently and coherently? So in terms of forming those descriptive themes and those analytical themes. You might want to ask about how reliable the studies, the individual studies included in the synthesis are, and have the reviewers highlighted anything about their quality which might affect the credibility of the synthesis. You might want to also look whether the results depend heavily on one or two studies, and if those studies were removed, would that change the results? And I'll show you an example of that next. Issue of context. You might want to be thinking about what context can the results be applied to? Do they vary across context? And this is where those study characteristics will be key. So what were the characteristics of the sample? What was the characteristics of the setting? And then ultimately you want to know whether the results, how well the results answer the review question, and what that result means. Next slide, please. So here's an example of where a review team have looked at the contribution of each individual studies in the review to the synthesis findings. So you'll see there the studies listed on the left-hand side, and across the top are all the descriptive themes from the review. And what all these little ticks highlight is that the synthesis didn't just rely on one or two studies. All of a number of studies are contributing to each of the themes there. So I would suggest if one or two studies were removed, it wouldn't significantly change the findings of the review. Next slide, please. So thematic synthesis has also been used with GRADE CERQua, which is a tool for assessing confidence in the findings of reviews. And there's going to be the next webinar in this series will be focused on GRADE CERQua. So you can see here analytical themes from this review, which was about the experiences of parents with a history of childhood mistreatment, and the analytical theme here, new beginnings, where becoming a parent is an opportunity for a fresh start, to put the past behind them. And you can see this table is listing the studies in the review that contributed to those findings, their methodological limitations. So here that the reviewers note that there were very minor concerns. And then each dimension of the CERQua tool, coherence, adequacy, relevance, are dealt with in turn. And in this case, the reviewers judged that they had high confidence in this particular finding from the review, this analytical theme. And then the final column talks about context, which context this finding might be applied for. And the reviewers highlight there that the finding comes mainly from a population of mothers from an ethnic majority. So they're less confident about whether these findings would apply to fathers and ethnic minority parents. So you can see there that this is an attempt to make it really explicit in terms of confidence in the review findings and the various problems that the reviewers have suggested, or points of caution to note in terms of transferring the findings. Next slide, please. So I'm just going to spend the last couple of minutes just talking about planning a thematic synthesis and the kinds of things you might want to get in place before you start one. And of course, there's a whole set of considerations that would apply to any type of systematic review before you start. So considering public and stakeholder involvement, how important is the review question and topic that you're posing, for whom, how might those stakeholders shape any particular question. You need to form a review team, develop a protocol, and set up systems for information management, etc. But for thematic synthesis in particular, when you're thinking about team composition, obviously skills and expertise in this type of qualitative analysis, as well as topic expertise, is going to be important. Thinking through the different roles that the different team members may play. For example, a balance between the coding, being involved in coding, generating descriptive and analytical themes. In the worked example I showed you, quite often the coding will be done by 2-3 members of the team, whereas the generating descriptive and analytical themes will generally be done by the whole team. And in the case of that review on older people and transport, the review team even brought in their policy advisors at that point. And then it's worth thinking about analysis software, whether to go for integrated with specialist reviewing software or standalone qualitative data analysis software. But it's good to have those decisions made up front, especially because this analysis software can be so important in terms of helping you to produce an audit trail of the synthesis process. Next slide, please. So that's all I'm going to say on thematic synthesis. So we hope you've enjoyed the presentation and the opportunity to ask questions. Just flagging the next webinars to be coming up. So GRADE CERQua I mentioned is on 25th of April, and the next one will be on metaethnography. So just before we end, just a big thank you to attending today. You can put the next slide on. You'll see our email addresses in case you want to follow up with either of us. Thank you.